Hi, my name is Karol Hoang, and today I'll be presenting the Eastern Ukine encephalitis, or what I will be referring to as Triple E throughout the presentation. What's the formal name? So the formal name is the Eastern Ukine encephalitis virus, or EEEV. Some common names of it are Triple E or the sleeping sickness. The infectious agent and taxonomy. So what causes triple E? It's the alpha virus. And here on to the right, it shows that the family is the Togaviridae, and the genus is the alpha virus, and that the species is the alpha virus eastern. So some characteristics of triple E is that it's a single-stranded RNA, and it has a spherical shape, and that the size or the diameter is 60 to 65 nanometers. So there's four distinct strands of triple E. So here, the first one is group one, and in group one, it consists only of the triple E virus, and it is an endemic in North America and the Caribbean. However, the other three, so 2A, 2B, and 3, are all related to each other and are related to the Mataranga virus and formerly known as the South American Eastern Ukine encephalitis virus, caused primarily uh, to the horses or Ukine. That's what Ukine means, horse illness in Central and South America. So onto the pathogenesis. So triple E is a vector-borne transmission with the Cusetta melaura mosquito serving as the primary vector, and its transmission to human and horse occur via the bridge vectors, as you can see here in the image, and they are feeding on infected birds. This mosquito is feeding onto this infected bird, which will then bite a horse or the human, and they will be the dead end host. So what happens in the cellular level? So once they bite or attach to their host, the replication of the virus begins in the lymph nodes, and from there, slowly the virus will attack to the central nervous system, and from there it will go through that blood-borne barrier, causing neural infection. And then after that, it will cause neural inflammation in the brain and cause neural damage and brain swelling. And from there, now that the virus has a home within the brain and keeps replicating itself, its persistent infections will cause encephalitis ultimately and will cause death or severe neurological impairment to the host. Some common symptoms are there are chills. So some symptoms of triple E are we have chills that you can have. There's joint pain that you may experience, and you have a high fever of 1 to 3 to 1 to 6 in that range, and then you have muscle pain that you will experience. So long-term effects of triple E. So the worst case scenario, we don't want this, of course. So when you get that initial bite from the mosquito, you have within 2 to 10 days to experience those symptoms that I've mentioned before. But after those 2 to 10 days, you can easily lead into these long-term effects, which are life-threatening and can cause permanent brain damage. Complications of triple E can include behavioral changes, issues with how your brain develops or functions, intellectual impairments. You may have seizures, you may have paralysis, or you may even be in a coma. And that's within 1 week or 2 weeks that you experience these symptoms. And then after that, that 2 to 10 days I mentioned, you experience maybe some of these long-term effects. Now on to outbreaks and ages and gender. So here in this table from 2003 to 2023, we can see that so ages of under 18 experience a high case of AAA when that could be because of that underdeveloped immune system. But after that, we get to see like lower cases. So from 18 up to like 50-ish, then we start to see a buildup in cases again. And we see from 50, 60, and 70, it just gets progressively worse because their immune system is not as good as it used to be. And we can see that here in the blue, that males are in this turquoise color, and that the females are in this purple color. And now you could say it's an even ratio. So either gender could get that. And here, so when I was looking up how many cases per year in the US you expectedly would see, it's 11 on average that is reported. To the next, so here we have another like table. I have a timeline from 2003 to 2023 of cases. So at 2005, go me, born that year, but maybe you don't want to be born this year. Uh, so we have experiencing a high case of triple E cases. So we have 21 here, and we get smooth sailing. We're chilling. We get 4, and then we get to 15. That's whatever. And then we get to 2019. We get 38 cases. So with these cases, it was the highest if in 50 years since its discovery in 1933, I believe, of triple E, and then from there, it slowly went down. Next, so incidence and prevalence. So uh, in that previous timeline, we show that the CDC reported there's 5 cases of triple E in the United States in 2021. And again, the highest of 38 infected cases back in 2019 in areas in Florida and Michigan. Then as of recently, when I was looking up triple E, it's kind of concerning. And you should be concerned too that as of December 3rd, 2024, there are 19 cases reported. And here, let me zoom in states such as Maine, New Hampshire, Vermont, Rhode Island, Massachusetts, New York, New Jersey, Wisconsin, and North Carolina. All of these states are reporting that they have triple E cases. And here we can see, we go back in that like kind of purple, blue color, we have 7 to 10 cases. So most of the cases right now, before the end of the year, for the year of 2024, we are seeing in Massachusetts and New Hampshire are experiencing uh, cases of triple E. Let's move on. So let me zoom back out. Here we have who's at risk and risk factors. So back from that like gender table that we were talking about earlier, we noticed that adolescents, so people younger than 18, so 15 and younger, have that experience of triple E or higher risk of triple E because once again, they have the underdeveloped immune system that they can't fight back this really fatal and deadly disease. And then as I saw that 15 old adults older than 50, so once again older than 50 here, they are more at risk because their immune system is weaker, but not as weak as when they're 70. Now that's when we saw like a lot more cases and people that were 70-year-olds versus 50. And so now let's talk about what are the risk factors of a higher chance of developing triple E. So if you're living or working in areas near where mosquitoes live and breed, so such as wetland swamps or wooded areas, so like in Michigan where it was the Great Lakes, cases around that area had it, and then in Florida, well, it's all over. So kind of have had that exposure to mosquitoes. And if you're spending lots of time outdoors, especially at dawn or dusk when mosquitoes are most active, well, you might want to reconsider because you have a higher chance of being bit by a mosquito, and this mosquito could be carrying this triple E virus. Now, moving on. Diagnosis. Can we diagnose triple E? Guess what? It's really hard. It's extremely hard to diagnose a triple E. So there's a way, but it's really hard. So you would just go into your health provider like normal, and you would get that physical checkup, and they would ask you, what are your symptoms? How are you feeling? So get those chills, you feeling that joint pain, muscle pain, having a high fever. They're like, okay, well, do you have any like insect bites? Well, yeah, I kind of have this one insect bite, and then you're just gonna continue to tell them like your symptoms and how long you've been having them, and then from there the test isn't really specific. Once again, you can't really diagnose triple E. It's really hard because they have very similar to like the flu symptom. So your doctor could be like, you just have the flu. But really, you don't. You only have like a few days to live. Um, so then they might ask for blood tests, and from there it would help narrow down like what you have and like because it's similar symptoms. So like you don't have the flu. Now let's move on to something else. Or they can ask for that cerebral fluid. So why would they ask for or that spinal fluid? Well, once again, once uh, triple E gets infected into your body, it affects the lymph nodes, and from there it goes to your spinal nerve, and then from there it travels upward and tries to get into your brain ultimately. So it's really hard to diagnose triple E. And let's see, what's next? Can you prevent and treat triple E? Guess what? No, we can't. There's no vaccine for triple E. Bummer. But is there a way to prevent it? Yes, there is. So how do you prevent it? Well, if we add that annoying bug spray, that horrible smell you just put it all over your arm, that repellent for mosquitoes, you got a good chance. So you want to add as much as you can all over your body when you're going out. And wearing long clothes, uh, long sleeves, or like anything to cover your arms and pants, wear those so that they have less, you have a less likely chance of being getting it. And now onto research and future outlook. So future is looking bright for AAA for this virus. So there are some tests that I saw on this like Canadian website. So what they're doing is they're integrating peptide synthesis with genomic and proteomic approaches. So what does that even mean? So it's advancing the triple E virus research, and with these advancements, it helps to identify the epitopes that's on the viruses and analyze protein expression profiles, guiding the design and of the most effective ways for research and therapeutic applications. And so with developing vaccines and therapies, well, that's huge if we can integrate the peptide synthesis. So with the advancing in research into the triple E virus, the protein synthesis um, will help develop like these novel vaccines and therapies, and with the help of virologists and peptide chemists and immunologists will be crucial in enhancing public health outcome. So before I show my references, I forgot to mention that this is once again really fatal uh, virus. There is a 50 to like 75% chance that the person being infected will not make it. And if you do survive, then you have like the neurological impairment or those impairments those long-term effects that I had here, paralysis, seizures, you could be in a coma, so stuff like that. So thank you for listening to my talk. Here are my references. And before I forget, I got to say, make sure to leave a like and subscribe and make sure to hit that notification icon for the next video. Thank you.